Welcome to the Food Junkies podcast. Here, we aim to bring you the experience, strength, and hope of professionals working on the front lines in the field of food addiction. Our mission is to educate you, the listener, and increase overall awareness about food addiction as a recognized disorder. Here, we discuss all things recovery, exploring the many pathways people take towards abstinence in order to achieve a health-forward lifestyle. We hope to inspire you to thrive rather than just survive. So stay positive, make a change for yourself, and share your journey with others. And hopefully the message will spread.
In the MGH-McLean Psychiatry Program, he moved from running traditional hospital care programs for conditions like schizophrenia and bipolar disorder to community-based work that utilizes lifestyle interventions like nutrition, sleep, light, movement, instead of relying on medications. He serves on the advisory board of Metabolic Mind and organized the first public conference on metabolic psychiatry in 2023. He speaks widely about whether some mental illnesses can be actually metabolic problems in disguise and about growing evidence for ketogenic diets in brain health. For our Food Junkies audience, we're specifically going to address how using ketosis can reduce cravings, change binge eating patterns, and improve mood and energy for people who struggle with food addiction. Welcome, Matt.
Thank you. Thanks for the introduction.
We'd like to get a bit of the personal first. What moved you from traditional psychiatry to metabolic psychiatry?
I'd always had a bit of skepticism about what we were doing, working on neurotransmitters and seeing how many side effects the medications have fundamentally means that we're working downstream from the root problem. Whenever your intervention has as many side effects or severe side effects as benefits, you're probably not getting right at the root cause. And we certainly see that with a lot of the psychiatric medications, especially antipsychotics and mood stabilizers and serious mental illness. And we'd also see just incredible metabolic issues going on with that population even before they start medications often, but then once we add medications, it makes it significantly worse. And there's about a 15 to 20 year increased mortality for people with serious mental illness. Most of that is from cardiometabolic causes. And then I had a whole issue with my family where two of my sons had what looked like a psychiatric condition. It turned out to be more of a autoimmune condition with their immune system attacking their brain. It really opened my mind to how important we need to start thinking about the whole body health in mental health. And then I heard a lecture probably about 8 years ago from Chris Palmer talking about reversing medication resistant schizophrenia and other psychotic disorders with ketogenic diets, and learned about all that literature from epilepsy and in diabetes now and all the mechanisms there. And I was really blown away by how solid the science is in terms of the mechanisms of how this works in the brain and how important metabolism is in the brain and for mental health conditions. And that sort of initiated my conversion. Probably started doing this in practice about 6 years ago. And I've really trying to talk about this as much as I can publicly so that people are more aware of this really important connection between metabolism and mental health.
Can you elaborate on that connection between metabolism and mental health? How can mental illness actually be metabolic illness in disguise?
Yeah, I think first thing people need to appreciate is how metabolically intensive the brain is as an organ. It's 2% of the weight of the body, and at any one time is using about 20% of the energy in the body. So it's very fuel demanding. It can run out of fuel very easily. And that's one of the important things that we think about is when is the brain running out of fuel? How does that destabilize networks? How can we get a more steady source of fuel to the brain? We also see in all these mental health conditions mitochondrial dysfunction, which are these organelles that are making energy, but they're also doing a lot more than that. And we can improve mitochondrial health with certain dietary interventions and other behavioral interventions. And then other mechanisms such as increased inflammation and oxidative stress, all that sort of happens as a result of these energy deficits. And we can also improve that as well by improving energy. And those are really important mechanisms for mental health conditions as well. We now have really abundant evidence. And then finally, working through microbiome as well. So microbiome gut-brain axis is really important. And We know from the epilepsy literature that's one of the main mechanisms by which the ketogenic diet actually improves outcomes in epilepsy is through the microbiome gut-brain axis. And we think that's probably a big factor in mental health as well, and why we're seeing such really early promising results using these specific dietary interventions.
Can you be more specific about how metabolism can lead to depression or even something like schizophrenia?
Yeah, so we think about these neurotransmitter models. That's sort of a current model that we're living in, where there's probably a deficit of serotonin in depression and norepinephrine. There's probably an excess of dopamine in schizophrenia and psychosis. And it's not that those things are wrong. I just think they're downstream from this more fundamental issue that's going on. When the neuron, the sort of main signaling cell in the brain, runs out of energy and doesn't have a stable source of energy, it can't do its primary job, which is to transmit a signal through neurotransmitters. And so the energy deficit is upstream. That's the root cause of why this neuron is not functioning properly. And it may manifest in different people in different ways through different types of symptoms and different neurotransmitter problems. But the fundamental problem is actually that neuron is running out of energy. And when we fix that problem metabolically, we can reverse some of those symptoms and actually not only not have side effects, but improve overall health and vitality at the same time. So it's a very different way of thinking about this. It doesn't mean that the medications aren't effective sometimes or that everyone has to go off of their medications, because that's an issue as well. And it's also tricky to take people off of medication when they've been on them a long time. Some people don't want to go off of them. But we do find that if we fix this fundamental root cause, the medications become less crucial. And for some people, they're able to lower them and actually they reduce that side effect burden. And actually that also improves their functional outcome as well.
Walk me through how depression can be created with this model from the very beginning. Oxidative stress, excess sugar.
Okay, so let's think about this neuron that is in an area where it is relying on insulin signaling to get some of its glucose for fuel. Now, not all the brain is insulin dependent, but a lot of the areas are, especially the hippocampus, very much an important area for something like cognition and depression. So that neuron is maybe bathed in glucose because the person just had a meal, their blood glucose is high, their brain glucose is high, but they have an insulin resistance in that neuron to the point where insulin's there, but the signal can't be received. And so that neuron's starving for energy. It doesn't make enough ATP. It's not getting enough glucose. That's causing it to fail in its primary job of transmitting a serotonin signal, let's say, if it's in a particular area of the brain. And that's going to cause, and this is an oversimplification, but I think to illustrate the point, that's going to lead to downstream some issues around depression. In addition, that neuron is going to have more oxidative stress. It's going to have more inflammation as a result of this excess glucose that's around that's not being used for fuel. Again, oversimplification, but that's the general idea. The mitochondria in that neuron are also not only not getting enough fuel, but they're generally known to be less in number and less in function than they would have been otherwise. And that's, been produced over time from this chronic fuel deficit and oxidative stress and inflammation that's occurred from that. Again, oversimplification, and it's interacting with all these other environmental factors like trauma and stress and life events and genetics. And so it's not the only, I'm not trying to make a case that's the only cause, but it is a cause through which all these other causes work through, because all of those other causes also lead to these things like oxidative stress and mitochondrial dysfunction and increased inflammation. So that this is all a pathway that connects to all these other root causes and explains the fundamental symptoms that we're seeing as well.
Can you use the same model to understand schizophrenia?
Yeah, we can.
Can you walk me through that?
It's very similar. The only difference being that neuron is supposed to be producing dopamine. And sometimes when a neuron is out of energy, it may get hypo, less serotonin in the case of that neuron. But in this case, certain neurons may become overproducers of dopamine and increasing their dopamine signal. They become hyperexcitable. So an energy deficit can lead to either hyper or hypoexcitable neurons.
That's really interesting. That would suggest something like bipolar as well. Bipolar.
Absolutely. Yeah. And we see signals in all of these conditions using these approaches. Schizophrenia, bipolar, treatment-resistant major depression, anorexia, OCD, or again, early literature, but we see a signal. And clinically, I'm seeing improvements in all of these conditions using this approach.
You mentioned insulin resistance in the brain. Can you talk about that?
Yeah, so some parts of the brain have insulin independent glucose uptake. And so they're not reliant on an insulin signal to get their glucose. But there's other areas of the brain that do
Like
need,
memory, you said.
yeah, in particular, memory areas and other areas that really do rely on an insulin signal to increase their fuel boosting when they need it. And if we don't have that, we see deficits in those areas. We do know that ketones can bypass that insulin resistance on very good scientific studies, especially in mild cognitive impairment. They give exogenous ketones and they see those areas uptake ketones when those areas could not uptake glucose. And so we know like very clearly scientifically that ketones are this sort of alternative source of fuel in those areas of the brain, which is very important because again, if an area runs out of energy, it's going to start having dysfunction, either again hyperexcitable or hypoexcitable, and all kinds of problems ensue from there.
Can you elaborate how Alzheimer's can be affected by insulin resistance?
Yeah, there's a much higher incidence of Alzheimer's in people with diabetes. And when people but even in people who don't have diabetes, we see that insulin resistance mechanism at play, and it can be bypassed again through ketogenic diets. And so there are some studies using ketogenic diets in Alzheimer's. There's one in particular, a small randomized controlled trial that showed significantly increased functioning using whole food ketogenic diets in Alzheimer's. They did not show improvements in cognition specifically, but it was a really small study. So we do need more research to solidify this approach from a therapeutic point of view, which I would be very interested in seeing. But there's definitely some early signal. I would say once someone is all the way to the point of very symptomatic Alzheimer's, a ketogenic diet is not going to be enough to completely rescue the situation, but it may slow it down. And the key would be to not get to that point in the first place, early on in life, trying to prevent that brain insulin resistance from happening.
Can you explain more about insulin resistance and how it leads to Alzheimer's before we get to the treatment part?
Again, same exact thing that we were talking about before. So the neurons in the hippocampus are insulin resistant. They need that insulin signal to get enough glucose. There's not enough uptake of glucose in those areas in the hippocampus, which are involved in memory. This can be rescued through this alternative source of fuel of ketones. In addition, though, those ketones are giving a signal to mitochondria to do mitophagy and mitochondrial biogenesis. So we're going to make more of those energy-producing organelles. And then over time, we think as well that lifestyle changes such as ketogenic diets and exercise can actually reverse that insulin resistance in the brain as well. Not only are we getting an immediate benefit, we're getting a permanent reversal of that root cause pathology as well.
Insulin resistance causes the memory loss and other attributes.
I wouldn't say it's the only cause of the memory loss. Again, I don't want to oversimplify for the audience. These are complicated conditions, but it's certainly an important factor in those areas of the brain not functioning at the level in which they can. And we see an early signal of when we reverse that, we get an improvement in those symptoms. But I would point people to the work of Dale Bredesen, who has an approach where he's looking at all the different possible ways in which the brain can fail in Alzheimer's. And as part of his approach is multi-pronged, and they're working on inflammation and infections and toxins and all these other things. But a fundamental part of his approach always is a ketogenic diet. It's part of that fundamental reversal process that he's using, but he has to add in a lot of other things. And so what I would say in Alzheimer's, most of the horses have left the barn, and ketogenic diet is going to bring a few of them back, but it doesn't bring all of them back. It's a late stage manifestation. Probably the pathology in Alzheimer's started 20, 30 years before symptoms is now what people think. And I would have people think about, do they have insulin resistance in their early middle age, and not just in their blood, but is it possible they have some in their brain? Do they have a little bit of brain fog? Are they starting to notice things? That's, to me, is a sign to say maybe my diet could really make a huge difference in the overall trajectory of my brain health over the next 30 or 40 years. And I think it's very powerful to think about it from that perspective.
So you mentioned ketones as a brain's alternative source. Can you explain a little bit more about that?
Yeah, so ketones are when we're in a fat-based metabolism. So a ketogenic diet is a high-fat, moderate protein, low carbohydrate diet, very low carbohydrate diet. So we're asking the body to now start mostly burning fat for fuel and not carbohydrate for fuel. There's still plenty of glucose in the bloodstream. The body will always make some. And even if we're eating no carbohydrates, we'll always have a stable blood sugar from our body's ability to make glucose. But the idea is that the brain can't get fatty acids. They're too big into the brain. There's the blood-brain barrier will protect and not allow those big molecules in. And so the liver chops up some fat into these littler pieces, which are ketones that can easily go into the brain. And those ketones can easily enter neurons without an insulin signal. So that's really this important thing we've been focusing on so far is that when there is insulin resistance, the ketones can just float right in without an insulin signal and be that alternative source of fuel for those cells that need it. And then in addition, the ketones are a signaling molecule as well for mitochondria to be recycled and to be made anew. Yeah.
The metabolic platform is a lot of research has shown to be very effective. For Alzheimer's, you were saying earlier, maybe not late stage, but in the preventative stage.
Yeah. Yeah, again, not proven. No one's done a study showing that ketogenic diets prevent Alzheimer's. I don't want to overstate, but
Yes.
what I would say is that knowing all the science and the mechanisms about how this develops and how important that insulin resistance in the brain is, that we want to take care of our brains. One of the things to really be considering and thinking about is preventing that brain insulin resistance when it starts to happen. And again, it can happen decades and decades before mild cognitive impairment. And I think really thinking about brain insulin resistance and making sure it doesn't occur is important for all of us as we're aging. And ketogenic diets or low carbohydrate diets are one really effective way to reverse brain insulin resistance. The other really effective way would be to exercise and make sure someone's really getting significant amounts of exercise in their middle age as well. And I would say the combination is even more powerful.
When you say ketogenic diet, around what level of carbs are you talking about? 30 grams of carbs or
It
up to
depends on the
60 or
person.
80?
Yeah, it depends on the person and what we're using it for and how high of a level of ketosis we're looking for. In someone with a treatment refractory mental health condition, we're shooting for higher levels of ketones. And someone with epilepsy, we're shooting for higher levels of ketones. Often we need to get the carbohydrates down to 20 grams a day. For lower levels of ketosis to treat a more mild condition or for more this sort of preventative idea that I'm talking about. We are just talking about low carbohydrate diets, more like 40 or 50 grams of carbohydrates a day, shooting for lower levels of ketones may be just fine and adequate for that person. And it does depend quite a bit on the individual and how much they're exercising as well. We find that when people exercise more, it's much easier to make ketones even with higher levels of carbohydrates.
Okay. How does the ketogenic diet fit in with addiction in general and then with food addiction, which is cravings for carbohydrates?
Yeah, so there's some early literature in alcoholism with ketogenic diets that it's pretty interesting. It looks like it reduces cravings for alcohol in the early stages of coming off alcohol. And then in food cravings and food addiction, I think there's some nice signals as well from ketogenic diets. And I think more is going to be published on this. But if you look at populations of people with who are obese, some with and without diabetes, people who are chronically overeating, their food cravings go down on ketogenic diets. And we see that as well. I see that clinically all the time. And people get into ketosis. And one of the most common things you'll hear is that I'm just not hungry in the way that I was before. And I don't have those cravings in the way that I had before. I used to be thinking about what dessert I'm going to have later in the day all day long. And now I don't even think about it anymore. So this is a very common thing that we see. And for the large number of people out there and probably in your audience who do have food addiction, who find that their cravings and their food noise are very high, I think this is a really viable thing to be thinking about to quiet that food noise.
Working in this field of food addiction, I discovered that we just ended up using a keto or low carb food plan without even intentionally doing so, just because get rid of the trigger foods and all of a sudden your food plan is a low carb food plan.
That's right.
Yeah.
That's right. Yeah. If you get rid of processed food,
Yeah.
you're generally going to eat a lot less carbohydrates. But I would still say paying attention to unprocessed food that's high in carbohydrates is still a really good idea as well. Yeah.
Okay, so tell us about your Accord program.
Yeah. It's been open for about 2 years. It's an immersive Metabolic Psychiatry Program is how I call it. So we have this small house outside of Boston, and people come from locally, or some people come from other parts of the country or even other parts of the world, because what we're doing is pretty unique. People come and we're immersing them in this metabolic approach to treat their mental health condition, meaning they're getting an individualized, well-formulated ketogenic diet. We have a registered dietitian and a chef on site. And that's one of the main sort of fundamental interventions. In addition, we're teaching people how to do that so that when they get home, they can continue to do it. So we're teaching people how to cook this food, how to shop for it in grocery stores, how to go to restaurants and keep eating that way. And we're doing that all with people as they're with us. Then we're getting people exercising, walks frequently throughout the day, but also with personal trainers. We're getting into doing some strength training and sometimes some high intensity interval training. We're getting people to do some mind body practices, which really support all of this as well, because they're also been shown to lower inflammation and oxidative stress and improve hormone signaling as well. And then circadian rhythm alignment is another part of it. So getting people up and seeing sunlight in the morning and throughout the day, and minimizing their blue light at night, having regular wake up times and meal times. Also a very powerful intervention that's synergistic with the ketogenic diet and exercise. And then whatever additional psychotherapy and other kind of work that they need as well while they're with us, we're able to provide. So it's this whole immersion, all of this all at once. And for people who have really not had a good time with traditional mental health treatments, we're seeing some really promising results, not just in their metabolic health, but also in their brain health and mental health and symptoms, but also functional outcomes, which is even more important than symptoms.
What you're describing, I would not expect to see in a psychiatric facility at all. Where I might see something like that is in a treatment center for addiction. So is
Right.
this the same where you're there for a month and
Yeah.
it's all intensive?
Exactly. Yeah, you're there for 1 to 3 months. So
Ah.
depending on the person and their goals and how quickly they're going to learn this and be able to sustain it at home. Yeah, that's that kind of time frame that we work in. You typically.
And it's a defined time, like I'm going in there for 3 months. It's not like going to the psych ward and being held for three
Correct.
months, like
Correct.
whenever
It's
you're
not
ready to go.
it's not an inpatient psych ward at
Yeah,
all. It's a nice house. We have an open door. People come
yeah.
and go as they please. It's not locked in. And in fact, if someone was that acute that needed a psychiatric inpatient unit, they wouldn't be appropriate to start these kinds of interventions. It would be hard to really have the types of discussions about, because this is really a long-term intervention. I know in your introduction you said that this could be quicker than medications. It's not often quicker. I would say medications are the quicker version to stabilize an acute psychiatric crisis, and they can be very effective to stabilize the acute crisis. This is more the medium and long-term plan. How do you get back to your level of full functioning after a big psychiatric crisis or multiple psychiatric crises over many years? How do you get back to life? I would say this is a big part of that. Yeah.
So I would imagine when people come in, they're burdened with either depression or severe anxiety, or do you see people with addiction as well?
We have some people with addiction. We have some people with psychotic disorder. Some people have chronic psychosis and bipolar disorder. Probably had more people with bipolar than any other diagnosis that come through. And the ketogenic diet seems to be very helpful in bipolar. For a lot of the clinicians who work in this area are very excited about what it does in bipolar disorder.
When I think about that, a house full of people that have various different conditions, is it chaotic? What does it actually look like?
It's not really chaotic. It's not a huge house. We're very small and it's very individualized. There's staff and clients interacting together, and it's very calm and peaceful. And people are by the time they come to us, they're very motivated to do this metabolic approach.
Yeah.
So they wouldn't come unless this was how they wanted to manage their condition. And so even when people are motivated, there's a lot to it. Everything that we just described, there's many things to learn. And if someone's still having a lot of symptoms but is motivated, I think we're a really great option for them, because you can use that motivation to really get the ball moving in the right direction and get some real wins and some benefits early on so that people feel motivated to keep doing more, essentially.
So presumably people already know the things that they should be doing out there in the community, but they're not doing them, even when they're motivated. When they come into this program, you've got it structured in such a way that they do it.
Yeah, you can't underestimate the power of support for
Oh,
getting things done. It's one thing to say, I want to do these things. It's another thing to go out and learn how to shop for a healthy ketogenic meal, bring it home, cook it, eat it, clean up the dishes, do it again 3 hours later for your next meal. And then also learning how to get back into exercise when you haven't done that in a long time, and how to get back into mind body work when you maybe haven't done that ever or in a long time. To do that all at once, it's just so much, right? And then people are still having symptoms. They're still depressed, or they're still
Yeah.
have executive functioning or cognitive impairments from their illness or from the medications or both. We're offering, and people really benefit from a really high level of support, and then seeing other people doing it as well. Someone else who's been there for already 3 weeks or 4 weeks and is much further along, and modeling yourself off of them can be really helpful too.
What are some things that you found that have been very helpful that surprised you, and what are some obstacles?
Within the treatment program,
Yeah.
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 I think really combining it all is very helpful. We just being ketosis can provide a lot, and a lot of the research studies are just doing that as the intervention, and we see some really nice results. But what I'm learning, and I think is really profound, is that the more of these things you do at once, the more benefits you can get, and the quicker
Right.
they happen. So, because each of these interventions supports the other. So, like we were saying, brain insulin resistance can be partly bypassed and helped with ketogenic diets, but exercise also really helps with that as well. And both
Right.
ketogenic diets and exercise also help make brain-derived neurotropic factor, and so they're supporting them both the same way. Yeah, and things like mind-body practices sometimes can be the missing piece. So even when someone's in ketosis and they're exercising, sometimes there's just a high level of vigilance and stress from previous traumas, and sometimes that's the missing piece. We need to get someone's sympathetic nervous system calmed down and their parasympathetic nervous system back online in order to really engage the healing processes that can start happening. And we can sometimes see that represented in their numbers. Their heart rate's elevated, their HRV is depressed, their blood glucose is still high despite not eating any carbohydrates or
Yeah.
very few carbohydrates. And often those are signals that the stress system is still in overload, and we've got
Yes.
too much cortisol and adrenaline, and that's getting in the way of all of these healing processes that might happen otherwise.
Okay. Interesting. What are some obstacles?
That would be like an obstacle, the stress, the traumas, and those are not, I'm not saying those are easy to work through in a few weeks. People's intense psychological connections to certain foods can be really hard to break. One thing our chef is amazing at is someone says, I'm really just missing this food. I want it so badly. She
Yeah.
can make a ketogenic version of almost anything, including pizza or birthday cake, like things that you couldn't even imagine. You can make a ketogenic version of that tastes good, but she can do it. And we try to help people through those earlier barriers with that. But there's still later barriers. I would say when people go back home, that's a really
I was gonna ask
challenging
about that.
transition for some people. And I think the whole culture and people's support network can sometimes be feeling like they're working against them. And because we've all, over our lifetimes, bought into a lot of myths that just aren't accurate around nutrition and food and mental health. We all bought into carbohydrates are absolutely fundamental for a healthy diet. We've bought into saturated fat is very dangerous always, and we've bought into these things. And so people may just implicitly be giving the wrong signals about food to this individual, whether it could be very well intentioned, but those things are happening. And then people have a lot of myths about mental health too, that there's no way these lifestyle things could possibly be powerful enough to make a big difference in your schizophrenia or your bipolar disorder. And people get those kind of signals from and messages from people as well. So there's a lot of things to undo in people's social networks that sometimes could get in the way. And we try to do a lot of education, these kind of forums, but also at our program with the individual families, we're trying to educate as much as possible as well.
Yeah, in the addiction world, it's great when the person's in treatment, but when they leave treatment, inevitably they relapse, except for a small proportion of people. And one
Right.
of the things that we've highlighted is the support network. It's not just changing the environment, that's absolutely essential, but that you need to have a bubble like you got when you were in the treatment program. You carry some form of that bubble when you leave the program, because social influences will disintegrate a wonderful plan. Do you have sort of aftercare group to keep that going?
We do. Yeah, we have a health coach who's very versed in ketogenic diets, and she's been health coaching that for years, who can follow up with people individually after they leave, but also she runs groups, and these are online, so people can do them from wherever they are. And then we really try to set people up with online support groups as well. And as much as possible, like I said, educate their families, but also their therapists that they're going back to and their psychiatrists that they're going back to, because those people are very influential and can also, with good intentions, sometimes give the wrong messages.
When you were talking about the keto diet, a lot of things will happen, like your food noise will go down and you're not hungry anymore. And those are the very same claims that I hear from the GLP-1s. What's your take on that?
Yeah, GLP-1s are powerful medications at reducing food noise and reducing hunger. Obviously, there's some really
Yeah.
significant side effects to think about. And so I think they can be a very useful tool for some people. I like the idea of people using them as a bridge to get to whatever lifestyle changes they're trying to make.
Mhm.
I think if someone's really trying to change their lifestyle and failing over and over again, it's reasonable to think about adding a low dose of a GLP-1 in there. And again, thinking about it as a temporary bridge. This is going to get you into a healthy lifestyle, get you exercising regularly, get you eating healthy foods regularly. And then the goal would be you may be able to come off of that medication if you weren't completely relying on it as the main thing that's engineering your recovery.
Yeah.
But if you are relying on it as the main thing, we know the data is that people relapse right back into their old ways.
Has there been any research on the comparison between keto diet and GLP-1 in terms of food noise or weight loss? Because the claims are so similar.
Yeah, definitely in terms of in the diabetes world and obesity world, there's a lot of really good data about using ketogenic diets, long-term data actually looking fairly favorable in comparison to GLP-1s.
Really?
Yeah, that's not to say that they're as powerful. I think probably it depends on the person, depends on the situation, but they look pretty favorable. Ketogenic diets look pretty favorable in that population. And obviously a lot less side effects, but a lot more effort, right? It's a lot
Yeah.
easier to take an injection or now a pill than it is to completely change your diet and lifestyle. But I would say if you're looking for the permanent, health change, not just for your body, not just for your waistline and your lab work, but for your whole body, for your whole vitality, for your brain health, I think the ketogenic diet, I think, wins out significantly. Yeah.
Yeah, and that's because it's long term, more
Yeah.
effort, and the
Right.
GLP-1s is immediate response and very little effort
Yeah.
and side effects potentially.
Yeah, and there's mixed signals on GLP-1s and mental health, by the way. That's a
Yeah.
whole other topic that we don't have to get into in depth, but there's definitely some big studies that show there were increase in new mental health diagnoses for people on GLP-1s. There's other studies showing benefits in mental health from GLP-1s. I don't think we know the true answer. I have my own pet theories about it. We just don't know the answer scientifically yet about why that might be.
Yeah, I'm anticipating with a bit of trepidation because I work in addictions that we'll see GLP-1s being prescribed maybe within the next couple of years for things like alcohol addiction. But I'm aware that there's also some concerns like the potential for anhedonia.
Yeah.
Yeah.
There's definitely concerns for anhedonia. I would say one of my biggest concerns is also about people who are not getting enough counseling or not making true dietary changes. And then
Yeah.
they're just eating one half of the calories of really poor quality, non-nutritious food.
Yeah.
And those people over time will develop nutritional deficiencies. And I see people in my practice all the time who get put on a GLP-1. They're not willing to do any dietary changes.
Yeah.
And they're just eating 800 calories a day of ultra processed food. And they will develop worse mental health over time because they're going to develop severe nutritional deficiencies over time. They're
Yeah.
not getting enough micronutrients and over time even macronutrients. And this is very common. And I think that's probably the reason why some of the big studies showed an increase in mental health symptoms. Those were the earlier studies when people weren't paying attention to the important dietary counseling. There's also this whole issue of muscle wasting on
Yes.
GLP-1s, and that's really concerning for long-term metabolic health, bone health, and really just overall lifespan and health span as well. Yeah.
Yeah. What about other medications? We know that a lot of psychiatric medications will cause insulin resistance. You probably see a lot of people coming in already on a cocktail of medications.
Absolutely. Yeah, I do. I do. And it's true. The medications can cause insulin resistance. The illnesses themselves are associated with insulin resistance even without medication. So that's also really important to say. And so we're making it worse with medications often. And so we're inducing people to have obesity, diabetes, worse brain insulin resistance. It's really problematic. And we don't get great outcomes in most of these severe mental health conditions in terms of long-term functional outcomes. And the field generally measures symptom reduction from medications, not long-term functional outcomes. There are some studies that show that when people work on a careful dose reduction, even in illnesses like early schizophrenia, the long-term functional outcomes may be better, actually, with careful dose reduction. And that's even without ketogenic diets. It turns out that I've been trying to taper people off of medications that are too high or not needed for a long time. And we often, if we go slowly and carefully, avoid withdrawal symptoms, we can improve people's function by lowering medication. But I see that the combination in my practice of doing the ketogenic diet and other metabolic interventions along with careful dose reductions is the most powerful combination for long-term functional outcome benefit.
Yeah. One thing I'm really struck with, you actually alluded to this, is that patients really like their medications.
Some do. Some
Yeah.
hate them.
Yeah, that's true. Some hate.
Yeah, I think it's usually this. Imagine if you've been hospitalized multiple times. You had a first episode of psychosis when you were young. You may have been using cannabis or in an inpatient unit. They put
Yeah.
you on this medication. You didn't like the way it felt. You went home. You took it for a while, and then you took yourself off of it abruptly because you really didn't like how it felt. And then your symptoms came back at full force, even worse than they were the first time. You go back in the
Yes.
hospital, and the doctors say that's your illness coming back because you were off your medication. And partly that's not completely true, in that partly that person was in medication withdrawal.
Yeah.
And so that made their symptoms come back a lot faster and a lot worse than the first time. It's not just their illness showing itself. But over time, that person learns that, and they're told that I need these medications to not be in an inpatient unit, essentially. And so people are very attached to a medication that keeps them out of that kind of psychiatric crisis and being locked in a psychiatric ward. So it's no wonder people feel very attached to them and scared to go off of.
Yes. Yes.
And it's just a full discussion that we need to have about all of that. And some people will still say, I'm not even willing to take any risk. I don't want to lower this medication at all. And that's fine. We can get lots of benefits just by adding all these metabolic approaches in terms of reducing side effects and improving health and even reducing symptoms. And over time, I see that for some people, the side effects can get even a little worse when they're in ketosis because they don't need that much medication anymore, is the idea. There's this sensitivity to medication sometimes that comes in. And I also just see that generally people can improve even more if we can gently reduce their dose from where it was before. But there's always a risk when we lower medication doses. So we have to be honest about that. We need to be working together about managing these risks.
In the Accord program, you would introduce the keto diet first, right? How long would you give that to determine some effect where you might think, okay, now maybe I can start prescribing?
It depends on the situation, how much symptoms someone's having, how much side effects they're having, how good of a response they're having to ketosis, how long they've been in steady ketosis. We often don't make a lot of medication reductions in those first 1, 2, or 3 months if it's a severe illness and someone isn't very over medicated to start. Sometimes we will make some dose reductions if there's a lot of medication and tons of side effects when they first come in. So again, it's dependent on the individual, but it's a long-term process to taper off of these types of psychiatric medications. It should not be done quickly. It needs to be done with someone who really understands tapering. There's a whole literature now on what we call hyperbolic tapering, which is by going by just a set 10% reduction over long periods of time and no more than 10% at a time, especially when we get into the later stages. We sometimes have to go even slower than that.
Yeah.
And I really do think if someone's thinking about medication tapering, to really do some homework and work with someone who really does understand the dangers and concerns with too rapid medication tapering.
So for somebody listening and they're thinking, okay, maybe I'll try a ketogenic diet, can you give a ballpark of when they might expect to see some change before they say, oh, this isn't working?
Some people, we get lucky and they see some early changes in the first week or two in ketosis. They start feeling more energy. Sometimes we'll start seeing some better sleep, sometimes some improved cognition. They can start reading more than they were before or focusing better than they were before. That's maybe that early mechanism of bypassing the brain insulin resistance
Yeah.
in those certain areas of the brain. But the changes in mitochondria and oxidative stress and inflammation and gut-brain axis, that stuff usually takes longer. So we see more changes over the next periods of 1, 2 months. And I would say I wouldn't give up unless you've given it at least 12 weeks in solid ketosis. And in particular, the other thing to pay attention to is that with some lab work that's probably worth looking at too, if you're not getting improvements, there's some things to take a look at that can be important, like what's your vitamin D level, what's your homocysteine level, what's your overall inflammation level with a CRP. And then specifically, we look at creatine levels in the blood too, because ketogenic diet uses up more creatine. And so some psychiatric medications also lower creatine. And so we will see maybe about a quarter of people with a creatine problem on the 1 month or 2 month lab check, and they need creatine repletion in order to get the full benefits of a ketogenic diet. So that's another one to think about if someone's not getting benefits and maybe why.
In the end, is the goal, is the possibility in the end, not right away, that a person may be able to walk away from their medications? Have you seen that happen?
I've seen it happen. Yeah, I know quite a few people who have come completely off of medication. I would say it's not always the goal at all for that individual or necessarily for me. I think the better way to put the goal is we're trying to improve someone's functioning through a combination of improving their metabolism and possibly reducing some medication burden depending on the individual. Yeah.
Okay. Now, in terms of food addiction, like I said, we ended up using a keto or low carb food plan just because we removed all the triggers. Is there anything else about the keto diet that would contribute to better functioning for food addiction besides removing the triggers?
Yeah, that's a good question. So, I think yeah, I think we're just getting this quieting of a hunger signal that's
Yeah.
very powerful from ketones itself. I think if someone's eating that clean version of a low carbohydrate diet, but they're still having some food noise, I would say it may make sense to consider because you're very close now to being able to just reduce the carbohydrates a little bit more, add a little more fat, and maybe a little more exercise, and be in some significant levels of ketosis to see if that actually fully quiets down the food noise. And there's, again, some studies in anorexia where they are looking at food noise in that population, even for people who have restored their weight, and some of them who still are a little bit underweight, and yet they're still having this constant sort of chatter in their head about food. And for those, it's not noise about having to eat more or hunger, but it's still noise about thinking about food all the time. And
Yes.
so it does seem to work on that. I can't tell you the exact mechanism. Dr. Guido Frank is the one that's been doing those studies out at University of California, San Diego, and he has a lot of theories about how this is working in the brain. He's a great person to follow or talk to if you're interested in that.
What's your opinion about exogenous ketones?
They're very short acting and they're expensive. So I don't find that as a chronic use case for most people that they're the best answer. They're thinking about using them more in certain populations, like people who do have mild cognitive impairment or early Alzheimer's who are in nursing homes where it's hard to change
Yeah.
what they're eating. And so they may have a use case there. They may have a use case in more severe forms of mental health, schizophrenia, where we can't get someone, they can't be in a place like a core. They don't have a network that's going to help them change their diet, but we may be able to get some benefit from some exogenous ketones. But I would say for the person who's already eating a ketogenic dietary tweaks are a better option to improve your ketones. Yeah.
But I get a lot of people who say you're eating really low carb, but you just can't get that ketone level up to the expectation.
Yeah, I think that's where you want to work with a real expert in this, like a dietitian who's been doing ketogenic diets for people to really break down your macronutrient numbers.
There's always tweaking possible.
There's always tweaking possible. We had someone recently where we realized that one of the things getting in the way for him, and he was doing well, he was eating the diet, he's exercising, but he always had dry mouth from his psychiatric medications, and he was using sugar-free cough drops all throughout the day.
Hmm.
And okay, that's not adding any carbohydrates. There's some artificial sweetener, but that seemed to be getting in the way. And we think that artificial sweeteners might cause an insulin signal, and maybe that was enough of it keeping insulin high to suppress his ketones. So there's always tweaks that can be made on the diet front. There's always tweaks that can be made on the exercise front. And anyone can make, not, I wouldn't say anyone, almost anyone, virtually anyone can improve their ketones through changes in these tweaks, I think.
Okay. A person who is eating a whole food plant-based diet, so they're not eating processed food, they're not eating sugar, but they are eating a lot of carbohydrates. They're good carbohydrates, carbs. What would you do for somebody like that who's coming in with depression or some kind of psychiatric disorder?
If they're looking to use this kind of approach, it is possible for that person to do a plant-based, vegetarian, ketogenic diet. It's not easy, but there are people. I know someone who does a vegan ketogenic diet. It's very challenging to do it. If you're trying to make use of getting ketones going, I think that's one thing to consider and think about. If they don't want to do, that's okay. I think we can start thinking about adding in all these other approaches as well. So really leaning into exercise and the benefits of exercise for brain and mental health and mind-body practices, great data for improving depression, anxiety, reducing stress. And also circadian rhythms are really probably an untapped potential there in terms of light exposure, especially natural sunlight exposure, and the timing of that and quantity of that can be very helpful too. If we can lean into all those other approaches, that person may not need to be in ketosis. But if they do want to be in ketosis, I think it's also possible for them.
Okay. So in closing, metabolic psychiatry, how has that been received in general psychiatry, and where is its future?
Yeah, great question. I would say 10 years ago, or maybe 8 or 9 years ago, when I first heard about this, it was not at all mainstream or accepted. I was fortunate enough to be in a Grand Rounds lecture where I heard Chris Palmer speak, and when I first learned about it quite a long time ago. But I would say most of the people in the room didn't pay much attention to what he was saying and didn't think it had any relevance to their practice at all. And so now it's becoming more a conversation that mainstream psychiatry is engaged in. And so that's really promising. Chris Palmer came out with a book. Dr. Georgia Ede came out with a book. Those have been really well-received books. There's now lots of research being published, and each time studies come out, there's more and more interest especially amongst the lay public, people who are suffering from these conditions and their families and their friends. I think mainstream psychiatry is now thinking about, a lot of people are coming in and talking about this, and I'm reading about this and I'm learning about this, and it's looking, there's something really going on here. And I think we're at that point now where people are starting to pay attention and they're thinking about learning more and hopefully starting to employ some of these in more places.
Do you think that big pharma will get in the way of this in the same way that we in the food addiction field see that the food industry, they're not going to support our efforts? Do you think that the same will happen?
Yeah, I don't think pharmaceutical companies and food companies are all that interested in this, and in fact are probably not happy about this. But I don't know that they've got the power necessarily when people learn something and are really believe it. Now, who knows? There can be all kinds of pieces written, and there are all kinds of pieces written, even in the diabetes world, where ketogenic diets have been shown to be really effective for a long time. It took a very long time for the American Diabetes Association to even list ketogenic diets as a viable option. There's all kinds of forces at play, and I would say we have a lot of work cut out for us in terms of changing the culture around all of this. Yeah.
Yes, I agree. So last question, signature question. If you could tell a younger version of yourself something about the ketogenic approach, what would it be?
Yeah, I wish I knew about this when I was in my 30s. I think I would have really benefited from it. In retrospect, I think I started developing insulin resistance way back then, and I was trying to eat a healthy diet, but I was needing to eat 5 or 6 times a day to keep my brain going. And I would try to eat fruit mostly, but I think over time that worsened my insulin resistance. And if I knew about breaking the cycle, as I did eventually about 6 or 7 years ago by doing some fasting and low carbohydrate and seeing how good I felt. I wish I had done that and way back then. And I wish I had raised my kids from a young age eating more that way as well. Yeah.
Thank you very much for speaking with us, Matt.
Thank you. It was a great conversation.
Thanks for joining us this week on Food Junkies Recovery from Food Addiction. Make sure to join our Facebook group, Sugar Free for Life Support Group, I'm Sweet Enough. Molly and Clarissa are food addiction professionals who offer one-to-one counseling and group coaching through Sweet Sobriety. Please subscribe to our show so you never miss an episode. While you're at it, if you found value in today's episode, we'd appreciate you leaving us a review on your favorite platform. Your feedback helps grow our show and allows us to reach others who need to hear this message of recovery. Don't forget to pick up a copy of Dr. Tarman's book, Food Junkies. And as Vera always says, the power is ours.